A few moments later.
Good morning, ma'am.
Yes,
What is your name?
my name is Sarah.
Sarah. And how old are you?
I'm 38 years old.
What seems to be the problem today?
I have a pain on my upper left canine.
Okay. I will have a look to see how can I treat it. But
Uh-huh.
first, I need to know about your medical history.
I have a hypertension.
Hypertension.
Yeah.
How often do you go to see the doctor to have it checked?
About every 3 months.
About every 3 months. And now, are you taking any medication?
Yes, I take Pridolol 50 milligrams.
Pidolol 50 milligram. What does the doctor say about your condition?
It's in control now.
Okay. Do you have any allergy to medication or any substance?
No, no, no.
No. Now let's move to the tooth question. Okay. How does the pain start and for how long?
It starts when I'm chewing and it persists for hours.
Okay. How would you describe the pain? Just like tapping or down?
It's down pain.
Down pain. Do you have any sensitivity when drinking cold water?
No, no, no.
No. Have you had any sign of sweating, chills, or feel weak recently?
No, no, no. It's only pain.
Really pain. How do you relieve pain recently?
No, no, no. It's only pain.
Really pain. How do you relieve pain?
It's relief when I take a paracetamol.
When you take paracetamol. Okay. If I compare with a scale, on a scale 0 to 10, 0 being no pain and 10 being the most pain you have ever had, how would you rate them?
Approximately 5.
Approximately 5. And after taking the medicine, does it relieve the pain?
Yes, it's relief. It's decreased to about 4.
Okay. And now let me check intraoral.
Okay.
The patient is a woman named Sarah, 38 years old. Her chief complaint is spontaneous tooth pain on upper left canine for 2 days. Medical history, which is hypertension. She goes to the doctor every 3 months and is given pranolol at 50 milligrams dose. Her hypertension is well under control. She also denied any allergy to any medications and anesthesia. Dental history. She had several dental procedures in the past, but cannot remember the exact details. Present illness. She has had the pain for 2 days, and it is aggravated by chewing. The pain persists for hours. The characteristics of the pain is dull and localized at the canine. The patient shows no swelling and signs of fever. She takes paracetamol for pain relief due to pain, which has a VAS score of 5, and it is reduced to 4 after taking the medicine. There's no sensitivity when she drinks cold water. Extraoral examination. The patient is presented with no facial swelling or lymphadenopathy. Intraoral examination. Upon intraoral examination, composite restoration is found on mesial surface of tooth 2-3. It has a history of drainage, and discoloration is shown. Electric pulp test gave a negative result on tooth 2-3 and a score of 42 on control tooth 1-3. Thermal test gave a negative result. Percussion test gave a positive result. There is no swelling upon palpation, but first-degree mobility is present. Probing depths are as follows. Tooth 2-3 and control tooth 1-3 have similar probing depths. But on distal buccal of tooth 2-3 has 4 mm depth, which is a sign of periodontitis. Radiographic findings. As for X-ray, the preapical radiograph demonstrates the distal part of tooth 21 to tooth 22. We can see the pneumatization of maxillary sinus and edentulous area at tooth 24 area. Tooth 23 in question has defective radiopaque restoration on mesial surface, which has underlying radiolucent area on the crown. We suggest it is secondary caries. Coronal third of the root canal is filled with radiopaque material. The apical area shows radiopacity around the root, which is hypersematosis. And on the mesial of the root, there's a widening of PTL space, loss of lamina dura at apical third, and normal bone level. While on the distal also shows loss of lamina dura at apical third, and alveolar bone loss adjacent to edentulous area. Diagnosis. With all the information we got from examination, we diagnosed tooth 23 with previously initiated endodontic therapy with symptomatic apical periodontitis. Treatment planning. If the patient wants to keep the tooth, our treatment planning will be as follows: RCT with refilling, veneer, crown, or internal tooth bleaching. But if the patient does not want to keep the tooth, the plan will be extraction with implant, TP, RPD, or bridge restoration.